Hi students, in this session, this is probably our 11th lecture in pelvis and perineum playlist, and in this session especially we are going to discuss here, and we are we have prepared here a slideshow related to the MCQs. There will be about 40 MCQs, and whose explanation, some of the MCQs will be explained and some of the MCQs are unexplained, but their key is there. So these MCQs have been actually projected here. Read all of them, solve them. Similar type of MCQs will appear in your upcoming exams especially. It is not just the exams which are actually undergraduate, but in all types of exams such type of questions actually are coming. We have gathered the questions from all types of past papers here and there, from USMLE, PLAB and here, but questions will be identical here. But I told you already also in many other playlists, in other lectures also in other regions, that MCQs never touch the MCQs until you have already covered two phases. One is the basic anatomy of the structure. Like here, these MCQs are related to the lecture number 1 and 2. These are actually the pelvis and perineum and overview. That is the first and the second lecture. These MCQs belong to that content. Means you have done that content probably, so that you have done that content properly, have understood them. That is the lecture number 1 and 2, and then we have the clinicals related to the lecture number 1 and 2, that is available in our 10th lecture. This is related to the clinicals related to the walls of the pelvis. It is called the pelvic walls. This is the second phase of study. This is the third phase of study. The third phase you will actually be starting when you have already completed the phase 1 and phase 2 in a proper way. I have understood them, I have taken their notes, you have seen their points here, we discussed with your friends, and when you have clear cut idea about the clinical correlations and the basic study, then you will feel at home and you will feel yourself comfortable, and you now enter into this third phase of study, that is called the MCQs. Do not actually jump into the MCQs in the beginning. Many of the students, you see, they prepare their exams through the MCQs. They will go in the reverse way. That means they will prepare their MCQs, it means they will prepare themselves for the exams through the MCQs, means through the explanations of the MCQs. They do not actually read the text. But do not go the reverse way, do not go the other way around here. Come here, watch the things before you see that, because this is not just the anatomy. Anatomy is the foundation, and on this anatomy is actually based your physiology, and on this is based your pathology, even in your pharmacology. And on the pathology will be actually based your surgery, medicine, ophthalmology, ENT, gynecology, obstetrics, everything is based on this. It is not possible that just for exam purpose you are actually doing the MCQs and their explanation you read, a similar type of questions will come and you will easily answer them. You can answer them, you can pass even the exam also, but your knowledge will not be sound here. And we will go to the other subjects. For example, the clinical subjects, you will be feeling yourself totally uncomfortable there, and you see that everything looks like it starts fresh. Means we will actually start the anatomy again. So better will be when you are actually in the anatomy, do the anatomy in a better way. Give your time. Actually, when you are doing your MCQs also, you also give the time. That doesn't mean that you are studying also, but this is the wrong way. The way is, do the first phase, then the second phase, then this is the third phase. Means third phase you should take after first and second phases have been completed. And when this is here, when you read the way to solve the MCQ or the way to answer the MCQs is that read the scenario comfortably, you see, relax and read the scenario. And when you are reading the scenario, your mind should actually navigate and should visit and have a tour of these regions which this MCQ is concerned with. So when you are actually doing this and see what the patient, which patient actually has come to you, what is the age of the patient, gender of the patient, what complaints he has brought, in examination what you are actually, which positive findings are, signs you are eliciting, and what are the findings in investigations, and what is your probable diagnosis here. And you see the diagnosis will be, if your basic knowledge is firm, if your basic knowledge is sound, you will see that even half the scenario you have studied, the diagnosis will flash in your mind. And sometimes if the thing is difficult, 3/4 of the scenario is over, the answer is in your mind. and sometimes at the end of the scenario you will be confirmed here. And now you will see the options A, B, C, D. Don't see the options first. I say don't see the MCQs before phase 1 and phase 2, and when you enter into the BCQs, don't jump into the options here. See the scenario and don't find the answer from the options. It should be your original answer. It should actually flash in your mind during study of, I say during going through the scenario findings here, and then you will see whether this answer has actually been flashed in your mind or not. If this is actually flash in your mind, you find out that answer in the options now. You see at which location this answer is, whether it is at A or B or only for this purpose you will see the options, not finding the answers from the options here. Answers, you see that if options are not for the answers, options are for seeing your answer at which location it is. And you will start actually jumping into the options here and will find the answer. And you will see when you find out your answer from the options, many times you see 3 to 4 options will look correct. When only single answer, this is a single based question. So, you see single answer is here, and 3 means you will actually be comparing between these 3. So, which one is more important? For this purpose you need more than 4 to 5 minutes, and each MCQ just allows you just 1 minute, 1.5, maximum 1.5. So, you will not be able to actually find out. So, find the answer by yourself. Do not find the answers from the options here. And once you have actually done them, you will feel, do practice. You see, when you do practice, you will just be accustomed to this. You will be get yourself used to these things now here, and MCQs will be much easier for you. Scenario based MCQs are much easier than those early days you see true and false type of basic questions. Scenario type of questions are maybe very easy for you if your basic knowledge. The phase 1 and phase 2 study, first phase and second phase study means the basic, they are clear concepts, conceptual study, and don't cram. You see that, don't cram and don't learn them by heart. Just you can say have a conceptual study. You say concept should be clear. You should learn these things here, and then you will be able to see these answers. So, we have prepared here MCQs playlist, and you see MCQ playlist. In that playlist you see in this lecture we have formed here the slideshow, and that slideshow will help you a lot. Do them, all the questions here, similar type of questions in fact will be repeated in many exams that you will face in future here. So, let us slideshow here and try to solve them by yourself here. But do this, you see, attend this lecture and watch this lecture once you have gone through your phase 1, that is the lecture number 1 and 2. This is the overview of the pelvis and perineum, and our lecture number 10 where there is the clinicals of the pelvis and perineum walls. This is the overview clinicals here. So, our lecture number 10 and 1 and 2, watch them properly, do their notes also, discuss with your friends, keep the concepts clear in your mind, and then you jump here onto the lecture number 11 and see and solve their questions here. So, watch this slideshow here.